Namaste. Thank you for joining us on Transform to Transcend Holistic 360. It is our great pleasure today to welcome to Pratimoksha Dr. Srikumar Goturu, dermatologist and medical director of Dr. Joseph's Clinic in Dubai. We also have with us Lalitha Viswanath, and together we are going to discuss skin conditions. Welcome Lalitha and welcome Doctor.
Thank you very much Maria, and thank you Lalitha. In fact, it's a pleasure, and with some trepidation I'm of walking into a field where I can have only an aspiration to be good at as it is. As a dermatologist and as a doctor, there are two main principles we work with. The first one is that is primum non nocere, which means we do not harm a patient in any way. And the second one is nothing ventured, nothing gained. And let me tell you that these principles are very important when we take care of a person holistically. It's not the duty of a doctor just to prescribe a medicine, and this is where you come in. We need actually holistic care in conditions of the skin, for example, the chronic inflammatory conditions like eczema and psoriasis. The psychological impact that the disease has is so high that people tend to commit suicide sometimes. I have seen families destroyed because of it. The economic impact, the physical impact, and the social impact is huge. So it's very important that we utilize tools like yoga, and I would like you to tell us that how yoga can be used to integrate a family as a whole and improve their physical and mental health. Please, ma'am.
Thank you so much, Doctor. Thank you for coming, and thank you, Maria, for inviting on both of us. Yeah. So, what I have observed through the years of teaching is that, like exactly what Doctor has mentioned, it has to be an integrated approach, and the family has to be brought into the picture and not the patient alone. And for this, we need to empathize the condition of the patient going through difficulties and the family too. And yoga plays a vital role in this case, because yoga has got different aspects to it. It's not just the physical practice of asanas. It has also got other disciplines like understanding the patient, understanding what human nature is, and meditative practices, breathing exercises, which will help the client, patient relax, and also as a group. So here is where we can have a group yoga session with the family, where they are able to function together as a unit in both the good and the bad times. And yes, Doctor, so I would
in fact, eczema is a condition that is probably the commonest inflammatory condition the human being has ever seen. I would say that nearly 25% of children have eczema, and it can run for even up to 7% even in adults. The interesting thing about eczema is that it's not just a skin issue. See, the itching and the sleeplessness that eczema induces impacts the most important function of a human being in their life cycle. So during childhood, they actually cannot play, cannot eat what they want, and they commonly suffer from asthma too. And they cannot study, they cannot go to school. So many classes they lose. I would like you to tell us how we can improve them mentally and physically right from an young age. Do you teach yoga to children?
Yes, we do. We do teach yoga for children. But children are not at an age where they can understand what the reason for their skin condition. So we request the parents also to come along with the child, so that it's both the parents and the child will understand what to practice, how to practice, and what to incorporate. For example, doctor will be able to guide us what's the difference of.
One of the issues that we face is that these people commonly have asthma. So breathing techniques and the improving the breathing capability of these children is a very, very important tool for us. So we sometimes advise them to learn swimming, and we ask them to blow balloons. But we do understand that pranayama is a very important aspect of yoga, and that breathing technique has to be learned properly. So as a master in yoga, I would like you to tell us about how you teach breathing and how important it is for us to do these kind of things.
So when we're talking about the breathing exercises, it's different from the practice of pranayama. Breathing exercises are like preparatory, which prepares the lungs and the abdominal muscles, intercostal muscles to engage while you take in the breath and when you exhale. So a proper breathing exercise must be a practice which has to be taught for children, and once they have understood the functioning of the lungs and the movement of the abdomen, then they can be taught the practice of pranayama. Now the practice of pranayama is also got to do with the mind. So this is
Yeah, I do understand that, and believe me, the eczema family is a distraught family. It's if the child cannot sleep, the mother cannot sleep. If the mother cannot sleep, the father cannot sleep. And it's a whole chain, and they do need to learn pranayama as a whole. And how would you teach pranayama to the family, for example, the adults of the family? And please do elaborate on the difference between pranayama and just a breathing technique.
So the pranayama is involving lot of mental disciplines. So if you allow me to go a little deeper, there's some disciplines called yamas and niyamas, which are self-observances and social observances. Now self-observances is what you observe, how I behave, what are the reactions that are in me that is creating a flare-up condition. These are all the analysis that one will have to observe. Similarly, the niyamas are certain disciplines that one would like to inculcate in their everyday lifestyle. So without this, the practice of pranayama does not carry any meaning. It's just a simple breathing exercise. So this has to be made to understand to the parents first, and then children will subsequently learn. They learn to observe themselves. They learn to see, okay, now it's because I'm anxious, I'm excited. There is my skin is reacting or my body is reacting. So they'll start observing these changes. Similarly, diet also plays a vital role. I think doctor is the best.
Of course, one of the interesting things that set me thinking is that, like as you kept explaining, I would really like to know how yoga and pranayama both together can reduce the anxiety and elevate the mood and remove depression in the entire family in these kind of situations.
Correct. So we all know that breath is like a mirror. It reflects the state of mind. When you're excited, your sympathetic nervous system is all up and ready to fight or flight, flee the situation. So when you'll feel the heart rate is going up, the body is warming up. So this indicates that you're stressed and the body is ready to fight. So where the breathing or the pranayama comes of help is, it'll immediately, when you take deep breaths, like when as children our grandmothers take a deep breath and take a sip of water and hold it in your mouth. What this does is it immediately calms the body and the mind. So
that's interesting.
Yeah.
In fact, we commonly tell our patients who go for the COVID vaccine nowadays, they check the BP. Yeah. And when the BP is high, they say, come back another day. I just tell them, most of my patients give me a phone call. I tell them, just sit outside, take deep breath for 5 minutes and then check your BP, you will be fine. Yeah. So breathing definitely has a huge impact on our body. It's and not just breathing. In fact, Maria, I'm sure you will agree that movement is very important for us. And in skin, it's not just the skin disease. You know that psoriasis is not skin deep. It's one of those conditions where you have a skin which looks terrible. It impacts the joints. Nearly 30% of patients have arthritis. The impact of psoriatic arthritis is as bad as rheumatoid arthritis, if not worse. And the joint movement is something that needs to be maintained. The joint involvement in psoriatic arthritis is something that is very important to tackle. Most of us are aware that yoga is a technique where not only do we improve our stability and body balance and stuff like that, but we can improve the flexibility and the mobility of our joints. Could you elaborate a bit more on this aspect of yoga?
Sure. So, the common interpretation of people when it comes to the word yoga, it means that they have to get into all sorts of postures and make their body hyper flexible. This is not yoga. Yoga is a very holistic approach where it involves all the different types of disciplines. It includes pranayama, it includes breathing exercises, and with that comes the asana. So with my years of teaching, what I've realized is it is difficult for somebody who is having aches and pains to even get the range of motion. So we can incorporate simple exercises like a stress ball. So we begin with simple joint mobility exercises, and then slowly move on to further challenging set of exercises. But this has to be done under a careful guidance of an expert.
So what I'm understanding is that a holistic treatment is required, and you, doctor, believe that yoga can be incorporated as part of your treatment options.
See, life itself is a matter of cooperation, and believe me, it's not the duty of a doctor just to prescribe medicines. And like I said, each and every aspect of the patient has to be completely analyzed. See, at every stage in life, there are various functions that we need to keep in mind. Old age, geriatric care, frailty, dependence on others, everything should be taken care of. And I'm sure that Madam here can tell us how yoga can actually make our geriatric age more bearable, and how important it is in our maintaining body posture and maintaining a balance and mobility when we become older.
Absolutely. So as we age, we tend to, this muscle loss, we tend to lose our range of motion. So when we are in, it's like especially when you're stressed, you'll notice the muscle tend to tighten. Now this is what happens when the mind is stressed. Automatically the hands or the legs or any of the joints will start losing its range of motion, that is the ability to get its full flexion or extension. Now with practice of breathing exercises and meditation and simple mobility exercises, you can preserve this range of motion so that even at old age we're still able to touch the pads of the fingers to our inside of the palms. Now this is a luxury for people who are suffering from arthritis.
That's very interesting. In fact, functional exercising and functional improvement is a very, very important component of treatment. And any medicine which is being licensed nowadays requires some regulatory guidance wherein we assess a patient's impairment in various ways: physical, psychological, social, economic, and we actually tabulate the severity of a condition. For example, in psoriasis you have various scores. These scores basically are assessments on whether a patient can move well, can feel pain, is it improving, is it worsening, how his skin looks. So these parameters actually need to be improved in a targeted manner. So we definitely encourage our patients to incorporate yogic techniques and other techniques, physiotherapy, diet. It's not just about medicines. So I would like to know whether yoga has an impact even in patients with severe infections. For example, we know that we are in the midst of a pandemic like COVID. Would COVID improve our lung capacity? With yoga improve our lung capacity?
So I'll answer this question in two parts. One is with regard to arthritis itself, whether it's rheumatoid or psoriatic arthritis. we have seen that the flare-up conditions, this is because of the autoimmune, the flare-up conditions are very much under control. They're able to control their emotions, so it gets into a dormancy. All right. Of course, it's palliative too. It's only palliative to the treatment. We cannot say that yoga will, cure or it will replace the treatment. It's only palliative. And the second part is when you see the COVID, like breathing exercises have played a major role. People are able to recover very fast back into their sleep routines, and they don't feel weak, as compared to people who have not exercised or practiced any of these modalities.
There is a condition called long COVID. In long COVID, there are probably a lot of patients who might have impaired lung capacity for a long period of time. Just imagine a youngster of 20 or 30 who recovers from COVID but still has impaired lung function. I'm sure your breathing techniques and other things would be very, very important for them. And they feel weak, and the weakness can last for months and years. COVID is not a flu, and the impact it has is something that humanity is only beginning to see. We are looking at the tip of the iceberg. So I'm very sure that this is a time where yoga plays a huge role in multi-dimensional care of a person. And I would like you to tell us whether you are aware of how it might impact conditions, for example, like AIDS, HIV positive people, people with chronic infections. I'm sure that everybody benefits from yoga.
Absolutely. So the recovery is quick, and as we know, AIDS is got no cure. But having said that, you can improve their lifestyle, you can improve the quality of life. And as a yoga community, what all of us have to take the lead, where all of us can take the lead, is to make the community aware of these the conditions or the health conditions and the difficulties of the mind. It's a challenge for them to be a patient and live their life throughout. So we have to be empathetic towards them and hold hands in support of them. So this will, for example, in offices, we can open our hearts and accept them gracefully into the society. This is where yoga as a humanitarian, on the humanitarian grounds, can help people. So it's,
of course, this is going to be a huge challenge. How would you say will be the impact of yoga in improving the mood of a person? We all know that the more positive we are, physically, mentally, and in all aspects of the mind, the more likely we are to be more productive, to be able to get a good job, to be able to feed our family. Would yoga be of use to a person who has lost a job recently?
Of course, yes. That's a wonderful, valid question for the present times. And the practice of yoga asanas play a greater role here, because what happens is when you're mentally demotivated because of loss of job or poor economics or whatever, you tend to get depressed. So this is where you have to push yourself to exercise. So asanas are not exercises. It has an impact on all the three levels: physical, physiological, psychological, and mental. So when you practice as asana, it's not just that your musculoskeletal system is getting enhanced. So here your other physiological functions are improving. It improves your confidence. For example, headstand. Headstand is a wonderful posture which I recommend to all people, irrespective of their age or issues, but provided it's guided. Yes. Now when you have to get to headstand, your muscles are engaged. So you have strong muscles, your bones are, they go through a stress called eustress, which, the strength of the bone improves. And internal organs, this rush of blood to the head, the brain has got rich supply and it nourishes itself. Similarly, to get to headstand, unless you're confident of the body, Okay, you will never be able to get to headstand. So this actually pushes your level of confidence not only physically but also mentally. So that's where it's threefold or fourfold effect of an asana practice. So asanas incorporated with breath. That's why they're called asanas. Otherwise, any physical exercise would be
That's interesting because I myself do a lot of workouts and physical exercises, and I've been doing it for many years. And I would say that it has helped me in a big way. We have always counseled our patients to consider all forms of exercises, including yoga and diet, and take care of themselves holistically. One of the big issues that mankind is facing is obesity and the metabolic syndrome. And in dermatology, for example, most of our patients with psoriasis, they end up being obese, having diabetes, having high cholesterols, and having a huge issue psychologically. Depression is a very common issue. So I'm sure that yoga is very important in not only reducing weight but also maintaining the diabetes under control. So tell us a bit about how yoga can be of value in patients with diabetes and obesity.
So diabetes, as far as diabetes is concerned, I've been speaking in front of an expert. It's a psychosomatic disorder, as we all know. So if there is an increased level of stress, as I mentioned earlier, fight or flight response, then your level of a hormone called cortisol increases, and this upsets what happens is the glucose level rises, and if the insulin is not sufficient enough to take care of the the energy levels, the body needs energy to fight the situation. So this hormone called cortisol is always on the rise, and this in turn will create issues, physiological issues like diabetes or blood pressure or cholesterol. And where yoga can play a role is when you are able to handle the situation with ease. So calm state of mind is required, and meditative practices and breathing exercises are really helpful for this.
How easy is it in the present day yoga era of having yoga classes set up online? We have Zoom meetings, we have technology coming up. Pratimoksha has been running a wonderful yoga center, but with the social distancing coming up and with people unable to move freely now, how could you actually use this time and this era for making this more interactive and taking it to a platform like Zoom or something like that?
Coming from the traditional background, it has been a challenge to shift from the hands-on to virtual. So that has been a challenge. But having said that, to keep the environment as well as public safety in mind, I think virtual classes are helping people a lot. So initially we start with one-on-one sessions, and eventually we go into group session virtually. All right, so that way people are still in touch with exercises. At least twice a week they get their exercise. Yeah.
Even for our patients now we have even virtual consultations. So sometimes we have so many patients who require to do exercises, yoga, breathing technique and all that. So if they are offered a virtual platform, and you could definitely keep them on rotation and give them one-on-one classes occasionally, but you could actually carry on virtually also, so that you have a hybrid kind of a platform. That would make things easy for most of us nowadays. Coming back to the skin aspect, as a dermatologist who actually takes care of predominantly skin diseases and to some extent the cosmetic issues also, how important is it for us to have a calm mind to accept some imperfections in our face which cannot be changed? I actually tell most of my patients that a smile is the biggest cosmetic that you can have for the face. But people nowadays are crazy, and they come with expectations which cannot be actually met. And sometimes we realize that there is some kind of a psychological issue here. I myself have seen so many people who come with minor blemishes on the face, and when I take the story, I find that they are in the cusp of a divorce or a separation, and they feel that it is the skin that is very important for them. But I try to tell them that look, it's not the skin. You look at the mirror and you smile at the mirror, the mirror will smile back at you. So it's more than skin deep, and definitely it's more in the mind. So how would yoga give us a change of perspective? Can yoga change the way we think?
Absolutely. It is, in fact, many of the yama niyamas itself teaches us how to accept the situation, accept yourself first as you are. There has to be a continuous rewiring, and here is where the lecture sessions, which involves the philosophy of yoga, that has helped a lot of people who are coming, because when we hold classes, initially we were just teaching asanas, but later we realized we are only addressing the superficial issues. We are not going deep, in depth. So that's when I realized, we need to talk to them, we need to understand what actually is causing the stress or what is in their mind. Like exactly what you said, doctor, I mean, a smile, and they're not able to look at the mirror and smile and appreciate their own inner beauty. It's only the external self that they're, seeing prima facie. So this is where, the philosophy of yoga, or what life is.
One of the things that I see is a resistance sometimes because of some religious beliefs. I usually tell my patients, see, consider yoga as if it's not something religious, and you take the good aspects of this. It's a very well studied branch, a science. In fact, I would like to call it a science. So what's your take on this? Is it something religious, or is it science based? How much of a science has yoga been through, and how has it evolved over time?
Okay, so that's a very deep question, and I'll just take a couple of minutes to answer that. Yoga is more a spiritual practice than a religious practice. So it makes you more religious if you are spiritually evolved. It helps you follow your own religions with a better understanding. So there it scores a fair point. Similarly, as far as the science is concerned, many of the yoga practices that were practiced in those days, today for example, Brahmari, they are talking about a scientific explanation of the nitric oxide, how nitric oxide is extremely important.
We have been having a very interesting dialogue, in fact, and I would say that one of the things that poses a restriction for us when we advise our patients on adapting yoga in improving their skin care or joint care or for any other physical ailments is sometimes some religious beliefs. So I always try to tell them that look, yoga is a science, it's not a religion. And I would like you to tell us how you would explain this to our patients.
In fact, that is something in our community, also among our friends, there is a perception of yoga being equated to a religion, is something that should not be done from a religious perspective.
Right. I'll take it from the roots of Pratimoksha itself. We're all coming from various beliefs, isn't it? The whole center is the 4 pillars of Pratimoksha are coming from 4 different beliefs, and we have integrated so well, which means it goes to say that yoga is beyond religion. It is more of a spiritual practice which helps you follow your own faith with a better sense. That's number 1. And the second thing is science. Yoga is a science of body and mind. So it's an integrated approach of science along with spirituality.
What else do you face as a common issue?
Actually, I think since we were talking about beliefs, another misunderstanding. A lot of people have, because skin conditions are very visible. So I'm sure Lalitha has faced issues where when students come in and people have some kind of skin condition, immediately there is a reluctance to accept, or So probably, doctor, you can tell us about.
This is a very, very, very important question that we address. In fact, the skin mirrors life itself, and there are conditions, for example, vitiligo, psoriasis, eczema, where you have very visible things on the skin. The psoriatic patches are so visible that it impacts the patient in a huge way. Many of them fear interacting with others. We know that psoriasis in the genital areas can impact family life, and it leads to divorce and all that. And we also know that fear that it is infectious is very common in public when they do not know what it is. Psoriasis is not an infectious condition. There is a genetic element to it, but it's definitely not an infection, and it doesn't spread by touch. And when they do yoga, and if their mat is shared by others, other people do not get psoriasis. It's the same story for eczema also. Eczema has a different aspect to it. It's not just the oozing, but it is the water pours from the skin. And it's so itchy that in fact many people are afraid that it's infectious. Most skin diseases, for that matter, are not infectious. It doesn't mean that we don't have infectious conditions. In fact, I would say that fungal infection, ringworm of the skin, is a very, very common thing nowadays. It spreads by wearing the same clothes, using the same laundry, and it can be one of the conditions where you shouldn't be sharing your yoga mats. I am sure that you do have very hygienic practices in your center. Can you tell us a bit about it?
So here at our center, this hygiene is the primary important factor,
and this is even before COVID times.
Absolutely, absolutely. Right from the beginning, we've always had smaller crowds, so not more than 6 to 7 people in a class. And we ask the clients to bring their own mats, their straps or yoga accessories, plus their own towels. And after every session, we make sure that it is being sanitized. Now, after the COVID, it has made it very simple for us. It's not an extra work for us, so it's as simple as that.
So you probably had a better time in kind of transitioning into a socially distanced yoga center rather than other places where there are more people. And
absolutely. In fact, I don't feel that we have transited. It's been part of our practice all the time.
Probably the only thing you need to do is to take the temperature when somebody enters, and keep a sort of a questionnaire where you ask whether they have had a fever or cough recently, as per government regulations anywhere. So I believe in Dubai they are doing a wonderful job of screening people.
Yes.
And how exactly do you do this in your center?
So as a practice, we as soon as they come, we do take their temperature. We don't allow them to congregate, too many people, just 1 or 2 people at our
And there is a gap of half an hour between sessions as well, so that one group exits or an individual exits, there is a sanitization which happens, and then the next.
Yes, and if at all, if any of the staff are in contact with somebody who has contracted COVID or any communicable disease, then we close the center for 10 days, make sure that the center is safe enough.
That's interesting. In fact, that is one of the biggest things that we face of late. Interestingly, COVID has a lot of skin manifestations too. COVID does affect the skin, and there are some characteristic features of COVID in the skin. And recently, based on a skin rash due to COVID, a myocarditis in a patient based on a skin rash due to COVID. So this is a publication which is going to come soon.
From a medical perspective, are there any restrictions or guidelines that you can suggest to us, to a yoga center, when practicing
You mentioned
yoga?
Most of it already.
Not COVID related, but probably in terms of
I would say
skin.
that COVID has just woken us up. See, any center which has a gathering of people should screen the people when they get in, so that we don't take in people with fever or active cough or anything like that. We need to keep hand sanitizers outside and at appropriate places. Hand washing should be a ritual, and of course the mat should not be shared. Of course we should make sure that we keep an appropriate distance. Of course we should encourage virtual classes and hybrid classes from now onwards, and it's very, very important that the show goes on, and you make sure that they are aware of the importance of yoga in all its dimensions. It's not just physical, it's mental, and it's more than that. I'm sure you know that better than me. As a dermatologist, I would say that the visibility of a skin patch doesn't mean that it's infectious. If you have a doubt, you can always gently tell the person to give you a medical report. We are more than happy to issue a report that a condition is not infectious. Very few people have conditions which are infectious in nature. Therefore, other than the basic guidelines, there's nothing big. And you are all doing a great job as it is. So just keep the good job going. That's all.
Thank you so much, Doctor. Thank you so much, Lalitha. So we've had a nice long discussion. I hope you all have enjoyed it, and it has been very informative, and we really thank Dr. Srikumar for joining us today. We also thank Lalitha, as always, for being here with us, and we hope to see you for a next Holistic 360 video. And until then, please stay safe and please stay healthy. Namaste.